On April 15th, the Ministry of Health would have started a STEP survey to find out a little bit more about what we can do to control our non-communicable diseases. This morning, I have Dr. Roma Bridgedal Nagasar, who's the Manager of the Research and Audit under the Directorate of Women's Health in the Ministry of Health, joining us this morning to give us some more information. Good morning to you, Doc.
Good morning, Rockus. Thank you very much. Good morning, Trinidad and Tobago.
All right, so tell us, what is the STEP survey all about? What are we trying to achieve?
Right, so the STEP survey, it's an instrument, a questionnaire designed by the World Health Organization, Pan American Health Organization, for countries to determine their population's risk factors for non-communicable diseases such as diabetes, hypertension, heart disease, cancer, and stroke. So it's the country's ability to find out how the population's risk factors to develop these diseases are, and it's for us to use this information to monitor all the interventions that we have in place for health promotion campaigns and to determine how effective our healthcare system is and to improve the service out there for non-communicable diseases to prevent them and manage them properly.
Okay, so just to break it down, when you say the risk factors associated with non-communicable diseases, we're talking about finding out if people already know their cholesterol levels, if they know their blood pressure, or is it that during the survey that's all part of what is taken?
So that's part of what is taken. So it's called a STEP survey because it's a stepwise approach to surveillance, which is monitoring for risk factors for non-communicable diseses. So
and some of those risk factors are what?
Some of those risk factors would be those that are modifiable, such as tobacco, smoking, alcohol consumption, your diet, and then others would be biological, so blood pressure, your weight and height, your body mass index, and cholesterol, and blood glucose.
Okay, so we monitor. So the survey is going to decide if these people already have it, or if it is that they are likely to get it, or all of the above?
It's looking for your risk factors. So you're determining like your consumption of alcohol, if you smoke, right?
But is it going to be directly related to? So let's say, for example, they come to do the survey by me, and I don't have any non-communicable diseases, as the case may be, but I do consume alcohol, I do consume tobacco, as the case may be. And is it that this survey now is going to say that I am at risk, or? So
it looks at your risk factors, and we're trying to find out across the population what our population is at risk, or what type of risk factors we have. So the last STEP survey was done in 2011 and published in 2012.
Okay.
So, and first of all, this survey is done at your home, right? And in 2011, we had about 2,000 persons responded to the survey. And for example, for tobacco, what we found was that 21% of those who we interviewed smoked cigarettes, right? And the mean age of starting cigarette consumption was 17.
Okay.
Right? And for alcohol consumption, out of the persons that we interviewed, we found that 40.4% consume alcohol, right? And then alarmingly, for obesity and overweight, when we checked our participants who took part, which is about 2,000 plus persons, about 50%, more than 50% were either obese or overweight, right? And that females had a higher obesity, were more obese than men, right? And 25% were actually obese out of those who took part in the survey.
Okay.
Right? So
and how do those numbers match up to what we see in the healthcare system as well, in terms of people who come in with non-communicable diseases?
Right. So this is looking at the risk factors.
Right.
Right? So that would be something
So we
different.
don't match it up. We're just looking at the society. We're just assessing the society.
We're assessing the population to determine the risk factors. So the last STEP survey was 2011 and published in 2012. So now we need to get up-to-date information to determine if the interventions we have put in place, if it's appropriate, and to do more health promotion campaign, and to look at and to do more health policies, right, to determine where we can improve, right?
All right. So how do I identify the people who conduct these surveys?
So the persons who will be coming would be field interviewers from the Ministry of Health. They will be wearing high visibility vests, and they will also have the logos for the Ministry of Health and for the STEP survey. In addition, they would be having having the Ministry of Health ID.
Okay.
So when they come to you, you would have to give informed consent and written consent to take part.
And it has to be an adult, I assume.
An adult. So the age category is from 18 years to 69 years.
Okay.
Right? And we're going across Trinidad and Tobago, and it's stratified across municipalities. So the 14 municipal areas in Trinidad and the one in Tobago. And only one person from the household will be interviewed.
Okay.
And it's a questionnaire. It's 3 steps. So it should take about 30 minutes to complete.
Okay.
And then the next step should take about another 30 minutes.
So it's about an hour and all?
Yeah, but it's really like about 30 minutes in the questioning.
Okay.
Yeah.
And in terms of the person in the household, how do we decide which person in the household gets the interview?
So it has to be an adult.
Well, aside from that, so if it's the mother, the father, it doesn't matter? Or does it matter? Or they answer on behalf of everybody in the household?
No. It's per individual.
Okay.
But it's one person.
Right. So how are the persons selected?
The person would be selected, well, they'll have to give consent that they would like to be selected.
Right.
And they will decide amongst themselves which one will be the person to be chosen.
Okay, so the information comes to you regardless. It doesn't matter to you whether it's, let's say, because we said 2000, was it 2011?
No, that was in 2011.
Right,
for
so
this
how much
one,
we aiming for this one?
5,400.
We aiming for 5,400 for this one. All
so
right.
we really, really would appreciate the cooperation of the country.
Well, of course.
When our Ministry of Health field interviewers come to your home, because we would like to get the information. The quality of the information is important for us to determine the service that we have available for our citizens, especially for non-communicable diseases.
Okay, and what about, so when you gather this information, is it going to be shared with the entire medical fraternity, or what is the information going to be used
So first of all, the information would be confidential, right? And you have to give informed consent, and at any time if you feel you don't want to continue, it's free, you're free to stop, right? Yeah, so it's all voluntary and confidential.
Okay, so is it, so all right, so when the person comes to you, this is all written, there's no physical test, there's no needles involved, there's no blood pressure monitor, any of that stuff involved?
Yes, it is involved. So basically it's called a stepwise survey, right? So the first step is the questionnaire, right? So you'll be finding out more about your demographics and your behavior, whether you smoke, you drink alcohol. And the second step, you'll be taking simple measurements, like your height, weight, circumference of your waist and hip.
And this one will be checking for the obesity.
Right, for your body mass index, right? And then the third step will be done on a separate day for biochemical profiling.
Okay. All right, so in terms of determining, you know, like we mentioned, who gets to be interviewed, most people work during the day. So is it that these surveys are going to be done outside of working hours, or how is it working?
Right. So let me come back to you. The participant is randomly selected from the household.
Okay.
Yeah.
Okay.
Right. So so if you have like 5 adults, it'll be randomly,
or whoever volunteers.
randomly gives informed consent and must be an adult.
Right.
Yeah.
Okay. And in terms of the time of day that we can expect these field surveys to be happening, is it during working hours when people may or may not be home, or how is it working in terms of that?
In terms of, it would be during the day, and so, yeah.
All right, so we're looking for households of people who might be remote working, or they might be home during the day, or shift workers, or whatever the case may be. Because, I mean, I see it like most people who work that regular 8 to 4 may not be available during the day.
Right, but it will be done at your home.
At your home, and that's important. Is it going to be done on weekends at all?
So far, as far as I know, it will be Mondays to Fridays.
All right, cool. Fantastic. So if people want to get more information about it, how can they do so?
Sure. So more information can be held on our Twitter account, Facebook, our Ministry of Health webpage. And you can also, the public may contact the Ministry of Health Non-Communicable Disease Unit. And the number is 217-4664, extension 16623. That's 217-4664, extension 16623.
And for those of you who missed it, it's actually on the screen right now, so you can definitely take down that number and you can get some more information from the Non-Communicable Diseases Unit. Now, just to be clear, can you give me an example of one of the programs that would have been put in place when we got the last survey, and we got the results from the last survey in 2012, that may have assisted going forward? so that we can know, get an example as to when that information is gathered, what sort of initiative the Ministry of Health is going to take?
Right, so we have like the heart disease program. We also have special clinics for persons who are diabetics and poorly controlled. We also have our chronic disease clinics in the community primary care centers that specifically target persons with hypertension and diabetes, heart disease. So we have all those services available in place.
And those would have been initiated post 2011 after the survey?
I wouldn't be able to say like how far those services would have been initiated, but this is also not just to look at how successful the interventions have been, but also to determine currently what our risk factors are now, right? So for instance, in the last survey, the average time for exercise was 42 minutes. So we'd like to know if that is improved. Also, at that time in 2011, 90% of those who were interviewed consumed less than 5 servings of fruits and vegetables. Is that better?
Hold on, less than 5 as in per day?
Yeah, per day. Yeah.
How much fruits and vegetables are you supposed to have per day?
5.
Jeez, angels.
Yeah, so basically, so it's to determine your risk factors of the population for non-communicable diseases.
All right, Doc. Well, thank you so much for joining us this morning and sharing this information. And of course, we want to encourage people, when the field officers come to your house, please cooperate with them and be honest, give them honest information and cooperate as much as possible. Yeah?
And I'd like to leave with our population to keep drinking more water, eating more fruits, and
5 times a day, apparently.
Get moving.
Yeah. All right. Thank you so much, Doc. Take care. Enjoy the rest of the day. We
much.
take a quick break, ladies and gentlemen, and come back with more on the Now Morning Show. Stick around.